Hi, welcome back to Takacs McGinnis Elder Care Law Hour. I'm Barbara McGinnis. In today's episode, we're talking about veterans benefits, what's available, who's eligible, and how do we get them.
And I'm your co-host, Tim Takacs, and we're continuing our segment with the gentleman from the Tennessee Valley Healthcare System. Welcome back, Dr. Stubbs.
Thank you.
And joining us today is Charles Noel. And Charles, would you tell us, or Charlie, would you tell us a little bit about who you are and what you do?
Yes, so I am the Whole Health Program Manager, and what that entails is I kind of oversee the cultural transformation at Tennessee Valley.
Wow.
Okay, so there are VA clinics located around the state. Tell us about what those are.
So we have roughly 12 to 15 community-based outpatient centers, and at those community-based outpatient centers we have usually our fundamental service, which is primary care, and we also offer mental health services at most of them, and we also offer some other services as well.
Well, who can get care at those clinics?
Any eligible veteran, and we usually have eligibility representatives there at each site that could help them get enrolled in care. And if they're already enrolled and want to go to those services, then all they will need to do is talk to their current primary care provider about changing.
Okay, so you said any eligible veteran. What does that mean? What is an eligible veteran?
Well, there's different criteria for eligible veterans.
Does that get into the do they have to be service connected?
Well, not necessarily.
There's
other pieces to it, and then they can come to the VA and talk with one of our veteran service organizations, our officers, and see if they are eligible for care.
Okay.
But if I may add, one
Sure.
of the main points is honorable discharge. They need to have an honorable discharge, and then
Right.
the eligibility goes on from there.
Okay.
So, in Sumner County,
Yeah.
what services are available in Sumner County?
Well, we're very excited about Sumner County opening up. That's going to be one of our first whole health centers, and what that is going to entail is we're going to offer primary care and mental health services there, but we're also going to offer whole health coaching. We're going to offer chiropractic care, physical therapy, and we're going to have physical therapy assistants that will be providing things like massage therapy, some functional fitness activities, and things like that, like yoga, Tai Chi, and services like that.
So do all the clinics offer those services around the state, or is this like because we're Sumner County we get more? Or?
Yeah, that's it. They're special. No, really what it is Tennessee Valley was selected as one of our flagship sites, and there was 18 facilities across the U.S. that was selected, and Tennessee Valley was lucky enough to be selected as one of those. So, and what that really entails is we have to offer a certain amount of services, and we're really looking at flipping our healthcare system from a traditional medical model into a preventative, holistic approach to care. So from the moment that the veteran walks through our door, we're trying to change their experience of, not really what's wrong with you, but really what is most important to you. And then we're going to start working with those veterans on what their values are and how we can relate their values to their care.
Oh, that sounds really innovative. Like, that might be really what gets to in healthcare, non-compliance is a big issue.
Absolutely.
And so finding out what's really important to them about their health care and how to get to that.
Yeah. And what we're doing right now is we're currently embedding all of our health coaches in our primary care model, so that way that's usually our fundamental service. So and where most of our veterans come through our system. So from the onset of them hitting our system, they're going to be linked up with health coaches that will use motivational interviewing skills. And
so the gateway to that is like the primary care provider who has, and the primary care providers are going to have a health coach?
Yes. And the way that it will be is whenever a veteran shows up, they're already going to be changing the conversation, saying, really what's important to you, why are you getting your health care, what do you live for, and then they're going to, if they want to continue that journey down health and wellness, then they'll be linked up with a health coach after that.
Yeah.
And what's so important is that we moving away from the disease entity, the disease model, to what is a functional status of the individual, so that they can get feedback and that these are the things important to me, so I can go back to my community and participate in my community in things that bring meaning to my life. So it goes from the clinical to the functional level of that individual.
Because I think you mentioned, in our last segment, you talked about, I like to use the term person-centered care as opposed to a patient.
Right.
Absolutely.
So is that really kind of what you're talking about here, is the emphasis of the VA, for the VA health system?
Absolutely. the patient-centered care, really this model really puts the emphasis on the patient and really what's important to them and lets them drive their health care. So if it's important to them, then we're going to try to give them the tools and equip them to be able to take charge of their life.
And the team works together in order to make that goal set by the patient achievable and realistic. So it really, people coming out of their silos. In the past, you have multiple providers and disciplines engaging the process, but now everybody's on the same page.
So what if you can't get there? Can you still access these benefits through some sort of telehealth model?
Yeah, telehealth definitely seems to be the future of healthcare, and Tennessee Valley is trying to definitely ensure that all of our veterans are eligible for telehealth, and we're definitely expanding those services as we speak. So all of our health coaches are going to be set up to where they can provide telehealth.
And also we spoke again in the previous section about home-based primary care, where we actually go out to the home and take care of those individuals, which is a very important program also.
Yeah. But it sounds like the integrative model is, you can't take all those people into the home.
No, you can't.
Yeah.
So, but definitely if our health coach can help facilitate some of that integrative piece and really talk to them and then, and then relay that back to their team, that's really the idea.
So we have a little bit of time. Can you tell us a little bit more about the telehealth thing? Because I'm trying to visualize, what that would look like for a veteran who maybe has had limited contact with the VA, and they live in, some rural area in Tennessee, and they definitely need services. Can you kind of walk us through what that would look like?
So currently they would have to be enrolled in care, and then we're currently expanding our primary care to also offer telehealth as well. So basically if they have a smartphone or a camera or a computer with a camera or any type of thing like that, they'll be able to access our services. However, they also have to have high-speed internet and the capabilities to make that happen, which may be hard in some of those places.
So that's I do think we've talked about it on some episode. I think we talked about that it's an initiative in the state of Tennessee to make sure that every community has internet accessibility, and I'm sure not only for a quality of life, but maybe for a quality of health standpoint as well, to be able to access some of these services. So what else? I'm really intrigued with this whole health thing. I love this idea.
Well, we're really excited about it as well, and we first was awarded as a flagship site last year, and we've kind of been implementing it through this year, and it's kind of been a long road to get it implemented and get it going, because it's really changing the culture of the way that we provide care. So
it's been in practice for most of this year then, isn't it?
Yes, but there's also limitations to getting people onboarded and building positions and getting things like that. So currently we're educating all of our providers, and in Clarksville we changed that CBOC into a whole health facility as well. And we have a chiropractor already there, we have a physical therapist there, we have an acupuncturist who will be there soon, and we have 5 health coaches that are embedded in primary care now. So they're already
in Clarksville?
In Clarksville.
Okay.
And then we also changed the way that the moment that you walk in, our clerks aren't really talking about how can we help you, it's more about how can we partner to get you where you need to be.
Ooh, and that starts setting the mindset too, because they've got to be a partner in it. It's not just about what you're doing for them, it's about what are we doing together.
Absolutely.
Yes.
Awesome.
Right, so we're talking about the Tennessee Valley healthcare system, and so I'm thinking now that when we convene here next year around this time, you're going to be able to tell us a little bit more, about what's going on in Clarksville and about the telehealth and the whole home-based primary care. Because that's kind of what I'm hearing.
If I may add, one of the things that we're doing at Tennessee Valley Healthcare that others aren't able to do or can't do is integrate geriatric care with that whole health model, and geriatric we really believe in.
And that's what you're working on now too.
Right.
So big things are happening at the VA. All right, we're going to put contact information up again. All right, we have, okay, I'm reading for our audience. They can read that already. So.
And when we get back from break, we're going to be talking with nobody from the Tennessee Valley Association anymore. We're going to be talking with someone about tax relief for veterans.
So stay with us.